How have the individual stories of your constituents living with kidney disease or in need of a kidney donation and the stories of living donors impacted or resonated with you on a personal level?
Thank you, Ed, for your kind introduction and the opportunity to appear at this policy summit for patients and living donors. And thank you to the advocates with AAKP for being here with us today. Your tireless work advocating for the men, women, and children who suffer from kidney disease by supporting bills like the Living Organ Donor Protection Act or otherwise will save lives. Several years ago, I saw firsthand how families come together to fight kidney disease. A member of my staff had a baby boy who was born in kidney failure. After 2 years of dialysis, doctor visits, and hospital stays, she donated her kidney to save her son's life. Her son, Ozzy, is now 13 years old. Their journey has not been easy, and they still face struggles ahead. Through my staff members' experience, I learned more about the roadblocks and struggles living organ donors may experience. Many cannot get the time off they need to recover from donating an organ because their employers consider the procedure elective and not eligible for time off under the Family Medical Leave Act. Other donors have problems accessing life, disability, and long-term care insurance down the line because of their history as organ donors, even though organ donors tend to be healthier than the average American. That's why I decided to introduce H.R. 2923, the Living Donor Protection Act. This bill prevents insurance companies from discriminating against living organ donors, allows organ donors to access FMLA time to recover from surgeries. This aspect is codifying Department of Labor guidelines from 2018, directs HHS to update their materials on live organ donation.
How have their stories about overcoming barriers to living organ donation inspired you professionally and fueled your dedication and leadership on this issue in Congress?
Stories from living organ donors like my staff member or my constituents have fortified my resolve to finish the fight to pass the Living Donor Protection Act. We in Congress should be doing everything we can to eliminate these obstacles to living organ donation. Organ donation saves lives, which should be reason enough to support them. What many people don't know is that organ donation saves money too. It cuts healthcare costs by as much as 2/3 by eliminating the need for many long-term treatments for chronic illnesses.
So many Americans doubt that Congress can agree on anything or even work together. Yet through your leadership, you've been able to assemble consistent bipartisan support for this bill in the House and the Senate, including Senators Gillibrand and Cotton. Can you tell us how you and your team have been able to do this?
Simply put, when you have good legislation, it's a lot easier to get support for that legislation. This bill is good legislation. Saving lives while simultaneously saving money isn't a partisan issue. Everyone can support this bill. However, you're right that it's often difficult to find things to agree on in Congress. My colleagues on the other side of the aisle and I have an important similarity. We both have the job that we have because we want to improve the lives of our constituents. When you sit down with people who may disagree with you and explain to them why something will improve the lives of people in your community, like the Living Donor Protection Act will, and you're open to feedback, sometimes you can build that bipartisan support. That's why your advocacy is so important. I'm proud that this year the Living Donor Protection Act has more bipartisan leadership than it's ever had before. I'm thankful to my House colleagues who are leading this bill with me. Republican Representatives Murphy, Balderson, Curtis, and Miller Meeks, and Democratic Representatives Blunt, Rochester, Costa, and DeGette. I'm also thankful to our Senate colleagues introducing the companion bill, Senators Gillibrand and Cotton.
What do you say to colleagues who have yet to sign on to this bill? Do you encourage them to talk to their constituents, those living with kidney disease, or those who are trying to donate their kidneys to save the life of a loved one? Can you provide us with insights into what it is like for you to champion this legislation on Capitol Hill?
To my colleagues who haven't signed on to the Living Donor Protection Act yet, what are you waiting for? This is smart legislation that will save lives by lowering barriers to organ donation and save our healthcare system lots of money. It has the support of a wide range of stakeholder groups, including the passionate folks with AAKP. I recommend my colleagues who haven't signed on to this bill yet speak with their constituents who have experience with kidney disease or living organ donation. Talk to parents who have planned to donate an organ to their child to save that child's life, only to realize that because their employer treats organ donation surgery as elective, they would be ineligible for unpaid leave to recover from their surgery. Talk to organ donors in your district who have struggled with securing insurance coverage after their procedures because insurance companies have unfairly denied them coverage. We must lower these roadblocks to organ donation. The Living Donor Protection Act is bipartisan, cost-neutral, effective legislation that will get that done.
Finally, Congressman, for the patients, families, and others who have not yet raised their voice or taken action to support the Living Donor Protection Act, can you tell us how their phone call or letter in support of this bill helps you and your team gain new congressional allies and move closer to the passage of this legislation?
Your advocacy is incredibly important. When you share your stories with your representatives and how this legislation could improve your life, you help build interest and support in the bill. Thank all of you for your tireless work to support donors, recipients, their families, and those who are still waiting. I look forward to working with all of you to pass this bill and save lives.